Good evening, everybody, and welcome to our webinar with Dr. Marianne Dorn this evening. We're looking at IVDD and recovering from pain for dogs recovering from intervertebral disc disease. It's a pleasure to have you with us this evening. Thank you very much, everybody who's booked and joined us this evening. We are recording this and we will send you a link to a private copy of the video that will be available on YouTube after the webinar. Marianne is happy to take questions from you. If you'd like to drop those into the chat window as we go through, we'll pick those up after the presentation and do our best to answer as many of those questions as possible. Really appreciate you joining us this evening. The fees for the webinar are being distributed to Dachshund Health UK and the Red Foundation. And I'm Ian Seath. I'm a trustee of Dachshund Health UK. Let me introduce Marianne. Marianne qualified in veterinary medicine from Edinburgh University in 1996. She's worked for many years in small animal practice, and then in 2014 she got a postgraduate certificate in small animal rehabilitation through the University of Nottingham. Since then she's worked as the rehab vet, and some of you may have visited her website, therehabvet.com. She helps patients with orthopedic and neurological conditions. I think she has a particular interest in dachshunds, having visited and seen lots of dachshunds in her time. Marianne has a special interest in dogs with IVDD and recently published her new book, the IVDD Handbook, and you can order a copy of that if you're interested from her website. So without further ado, I'm going to hand over to Marianne. Have a great evening, everybody. Please do capture questions in the chat and we'll look forward to talking with you after the presentation. Marianne, over to you.
That's great. Thank you, Ian. Can you hear me all right? Yeah. Okay, well, it's lovely to be here. Thanks for joining us. So yes, I'm going to talk about dogs with IVDD, this time focusing on helping them recover from pain. And regarding pain in dogs, it's absolutely incredible to think that just a few decades ago, some people believed dogs didn't really feel pain. And perhaps that's because some dogs are so stoical and they act on instinct, and they may continue to run around apparently almost as usual, even when they're going through something terrible like an injury. However, now we know better. Yes, they certainly do feel pain. They have similar nerve pathways to us, and they probably experience pain in quite a similar way to us. Let's start by looking at spotting signs of pain so that you can help your dog. Now, this is how dogs really do differ from people. They show pain in quite a different way to humans. Whereas we might complain a lot, we might cry out or maybe swear and maybe complain. Many dogs don't really do that. They often keep quite quiet about it. They might yelp, but more often what you'll see is these signs here. So many dogs with back or neck pain, they typically don't want to move around very much. There are exceptions to the rule, but quite often they'll just kind of try and stay in one place through the worst of the pain, particularly not wanting to jump up, not wanting to walk over a step, not wanting to go for their usual walks. They may have quite a rigid posture, and perhaps they may even be hunched, like this dog here, who was previously looking normal and had started to look like this, very, very hunched over, very rigid. Now, that's not to be confused with a dog. Some dogs, if they have a bout of IVDD, back trouble, and it's treated, and maybe during their recovery, they might just have a bit of an arched back, just because the muscle tone has changed, and then they take a while to get back to normal. That kind of arched back actually isn't usually painful, but this, if they just come down looking like this and they hadn't had a problem before, that probably does indicate they're painful. And another thing we typically see, especially with dachshunds, is squealing on being lifted. So perhaps the dog might look quite normal, but then when we pick them up, they just have a little yip or a squeal, and that's very typical of either back or neck pain. Some dogs might also lick or bite repeatedly at one area, which could be they might lick at one leg. There might be perhaps referred pain coming down that leg, or they might try and sort of lick their rear end or their haunches. It doesn't necessarily mean they're painful. It might mean they've got an itchy condition, but this is something that we do sometimes see in dogs with back and neck pain. Sometimes the pain comes and goes. So they might have bouts of pain. Got a little video here of a dog called Ernie just experiencing a bout of pain, poor boy. So here he's trembling. It's like he's shivering, but he's not actually cold. And this is quite typical in some cases. Not every dog will do this, but dogs that really shiver with pain, that's quite typical of back or neck pain. And he's also lifting a front paw. Let's play that again. So he's lifting a front paw. That's another thing they sometimes do. And he's got very tight muscles. And another thing that dogs might do during a bout of pain that we're not seeing here is panting, even if they're not hot. And some dogs, you might notice their face changes when they're in pain. And this can be different to how we humans look when we're painful. So it can be helpful to know, like, what does your own dog look like when they're comfortable? So then just have a think about that. And then it might help you recognize how their face changes when they're painful. This is a page from the IVDD handbook, and this is illustrating dogs on the left that are painful and the same dogs on the right now comfortable. And I think maybe the most dramatic picture is the middle one here. This is George, the French bulldog. Here, when he's painful, poor boy, so he's got his ears flat back against his head. That's quite typical in French bulldogs. And the muscles around his mouth and muzzle area are so tight that his muzzle sort of looks squashed. If you compare that to this soft, rounded appearance of his muzzle when he's when he's comfortable. And here, of course, his ears are upright, and he's also more relaxed around his eyes. It's not quite so obvious, but there's a sort of a change in the muscling around his eyes. So that's his typical change. Perhaps with the dachshunds, it's not quite so obvious, but this is Ernie. So his ears are actually clamped down, and he has got very tight muscles around his eyes and mouth. And sometimes it's something that you as owners can actually spot better than us vets, because you know your dog so well. So it's a helpful thing to look out for. I won't talk for long about other signs of IVDD because we're really focusing on pain today, but I just wanted to remind you that dogs with IVDD, they are, almost all of them are painful, at least at the start of the condition. But some of them go on to have other signs as well. So they may have difficulty walking, like this dog here, who's staggering along and he's crossing his hind legs as he moves. They might knuckle their paws upside down like this, which is abnormal. Or if they're very severely affected, they might be unable to walk and just drag their hindquarters behind them. So let's just consider, before we go on to think about how we can help these dogs, let's just consider what it is that's making them painful. We'll have a quick look inside the dog. So dogs, just like us, they've got a spine made up of many bones, little bones called vertebrae. And here we've got a diagram of one vertebra, one bone of the spine. And here we've got a disc. So there are discs, and just like us, dogs have got discs in between their vertebrae. And these discs, they're largely made of cartilage, and they cushion the spine as the dog moves. And in this diagram here, this is from a dog with IVDD that's experiencing what's called a disc extrusion. And in that condition, so the outer part of the disc has actually split or torn, and the inner part is pushing out, and it's pushing out, and it's actually pushing upwards, and it's coming up. And here we have the position of the spinal cord. So this is pushing up against there. And that's what happens with the disc extrusion. And when we say IVDD for dachshunds and French bulldogs and other small breeds, we usually are referring to this, a disc extrusion. So the pain actually comes from close to the disc. There's a piece of tissue here that's not even drawn on the diagram. It's just where I'm moving my cursor. So it's above the disc and just below the spinal cord. And there are lots of pain receptors there. And that piece of tissue, it's a band of tissue called the dorsal longitudinal ligament. And that does contain pain receptors. So that's where a lot of the pain comes from. And it also comes a little bit from the outer part of the disc itself. There are a few pain receptors around here and a few just in the outer layer of the tissue surrounding the spinal cord. But actually there aren't pain receptors everywhere. It's just in these specific places that we're really getting that nasty pain response for these poor dogs going through back or neck pain. And so that they experience it early in the condition as the inside of the disc is pushing out and those pain receptors get affected. And it's particularly severe if the disc kind of explodes sideways or ruptures sideways, because the greatest concentration of pain receptors are actually in, to the side, either on the left or the right side of the disc. So that's what's happening close to the disc. And also we can consider if the dog has surgery, then tissues where the surgeon has operated, the skin and the underlying tissues, they just have to recover for the first few days to maybe weeks. There'll be a bit of inflammation there as the tissues are just healing up. So that can cause its own kind of little bit of discomfort and just needs to heal up with time. And there are other things that can add to the pain as well, and it's helpful to know about those. So one of these is tight muscles. In people, there's a theory called the pain spasm theory for people with backache. And what happens there is someone can have backache, they're feeling painful because of what's happening around their spine. And so their muscles around their back muscles actually seize up and tighten. Those muscles are tightening in an attempt by the body to stabilize the back. And that tightening of the muscles is in itself quite painful. And then the person becomes even more painful and the whole thing continues. And that probably happens in dogs as well, with muscle tightness actually increasing the level of pain. And with dogs and with people as well, fear or anxiety can both lead to even tighter muscles, just because, there's this behavioral response in which we sort of tense our shoulders and muscles all tighten up when we're feeling worried. So that can contribute to pain in itself. And in both humans and dogs with back problems or neck problems, we can also get a problem in which the nervous system becomes overactive. And that's a phenomenon that's sometimes called wind up. And what happens there is that nerve cells start firing when they shouldn't do. So, for example, a person who's just had back surgery and they're just starting to recover, if they're experiencing this, then even someone just lightly touching their skin that in itself could lead to a terrible feeling of pain that's completely illogical, and that shouldn't hurt. And this, if it goes on, it can actually contribute to chronic pain, long-term pain, and that can continue to cause pain problems even after the original cause even after the original physical cause of any pain has disappeared, even after the disease process has gone, the person or the animal may be left with this very overactive nervous system and a tendency to feel pain even when it's not necessary to do so. It's sort of inappropriate pain. And this can easily happen with back or neck pain. Actually, some of the studies that have been done on this have been done on animals initially, and that's how we've then found out more about it in the human field. So animals can suffer from this as well. And we know from studies that psychological stress and anxiety can contribute to this overactive nervous system developing. And then finally, another reason for pain is just tissues being inflamed and swollen. And this can follow on from surgery, but it will also follow on just from having the disc extrusion, the IVDD incident. And it takes time for this inflammation to go down. And if the dog does too much too soon, then everything becomes swollen and inflamed again, and then the pain can come back. So to help these dogs feel better, there are several routes we can take, and it's helpful to do all of these things. One is, of course, to give them good painkillers. Another is to reduce their stress levels. And another is to help them to rest during recovery. For their painkillers, definitely see the vet. To reduce their stress levels, well, they need a nice comfortable environment, so just sort of tender loving care, and we'll talk about that in a moment. And it's also helpful if they have a regular routine, and then they know what to expect each day, and that could just help them sort of accept what's happening and reduce their stress levels. And it's also helpful to handle them with care, with nice, gentle, positive handling techniques, so that they're not sort of constantly on edge and worried that they're going to be hurt, even accidentally. And to help them rest, most of these dogs are smaller breeds, and it's generally appropriate to set them up in a crate or pen to keep them safe, and consider how they're going to be kept safe and rested, even when they're outside their crate or pen, because they will need to get outside at some stage for toileting and so on. And of course, just don't let them do too much too soon. So their exercise needs to be built up very gradually. Lots of details, really, for all of those topics. So a great resource for you could be this book, the IVDD Handbook, which is now available. When I last looked, it was still actually on reduced price through Amazon in the UK. I'm not sure how long that's going to last for, the reduced price, but it will be available ongoing with next day delivery. So this handbook, it's a complete guide to home care to supplement what your own vet's advice for your dog. Includes advice on crates and pens, advice on home techniques, including everything from sling walking to the handling techniques I'll go through today, and bladder expression and cleaning your dog, all sorts of things, examples of daily routines, and lots more advice as well. So let's look one by one at these different ways we can help our dogs. And the first is, of course, getting help from your vet and getting painkillers prescribed. Now, do certainly get help from your vet with this. Never ever just reach for painkillers from your own medicine cabinet. There are several reasons for that. One is that dogs and people have different requirements for medication, and some very common medications used for people are actually poisonous for dogs. And also the dose needs to be worked out very precisely, needs to be the right dose for your dog, not for your neighbour's dog or whatever. And sometimes the dose and the type of medication actually needs to change through one dog's lifetime as their needs change. So your vet can examine your dog, they have your dog's clinical history, and they can check that if any medications are used together, they're not going to interact with each other, and it's all going to be safe. Many vets prescribe 2 or more different types of painkillers together, and the fancy name for this is multimodal pain relief. And this is very helpful because the different types of pain medications work in different ways. So then we're really combating the pain in different ways at the same time within the body. And that's actually a safer, more effective way to do things than giving a massive, great big dose of one painkiller. So a typical painkiller regime, these days we often include one drug from the group called NSAIDs, or non-steroidal anti-inflammatory drugs. And what these do is they reduce the inflammation. They reduce any swelling and inflammation. One example is Metacam, but there are very many others. And so often what we do is use one type of NSAID plus often we go for gabapentin or sometimes pregabalin. And gabapentin is it works specifically for pain to do with the nerves, also called neuropathic pain. So these 2 types of drugs work together very well in many cases. And I've put plus or minus others. So occasionally there'll be a 3rd drug added in, or sometimes some dogs just can't use one or other of these types of medications. So something may need to be swapped in or out. So sometimes, for example, a vet may prescribe paracetamol, or they may prescribe possibly tramadol, although that's likely not anything like as effective as a painkiller in dogs as it is in people. So it's often not a first choice. Occasionally there might be an opiate prescribed. And sometimes muscle relaxants are prescribed. Just as I mentioned, the muscle spasm itself can be painful. And I've put here steroids in brackets because they used to be a very popular choice. They were often prescribed to reduce the inflammation of IVDD, but we now know that that's really not a good idea in general. So it's been shown in studies that steroids, dogs with IVDD, especially in the early stages, they tend to do less well if they're on steroids. Steroids are associated with some important side effects, and the problems with those side effects can actually outweigh the benefit of the medication. So having said that about the medication, please don't suddenly change. If your dog is on a certain regime, please don't suddenly change what they're on based on what I've just said. Speak to your own vet, because if your vet's prescribed something, it's been prescribed for a reason. So always discuss things with them before you consider changing anything. When you take that medication home, do check the label first. So it may need to be, it may say twice daily, 3 times daily, once daily. With those doses, spread them evenly through the day unless you've been told to do otherwise. So dosing once a day means every 24 hours. Try and do it at the same time each day. If it's twice a day, that's every 12 hours. So for example, 8 AM and 8 PM. And if it's 3 times a day, it should really be every 8 hours. So do your best to really spread them. If you can, something like 7 AM, 3 PM, 11 PM. And now I put here, you can hide the medication in food. Now check first that medication can be given with food. Many of the drugs used for IVDD can be, but not all of them. So just double check that. And then think about how you're going to hide it. My first choice would always be a spoonful of the dog's usual wet dog food if they have wet dog food. And it's good to just kind of hide it in a spoonful of that before they go on to eat the rest of their meals, so you know they've had it. If you're using their usual food, then you're not adding into their daily calorie allowance, because really what you don't want to do is to have them put on weight. And if you're not careful, if you're giving them something high calorie with every medication, that can easily happen. But some dogs will need something more appetizing in which to hide the medication. So my next choice really would be the kind of liver paste that's actually sold for dogs. And just a little smidge of that is often enough to disguise medication. Or ham or sliced chicken breast, they usually go down well. You can kind of wrap it round what you're giving. I put cheese here with a question mark because it's a popular choice, but very many dogs do get stomach problems or anal gland problems as a result of having cheese. So watch out with that one. And then with the medication, keep in touch with your vet. Do arrange a recheck because every dog is different and the dose may need adjusting. And check their out of hours arrangements because it's possible you might need to bring that recheck forward. IVDD is quite an unpredictable condition. So let's now think about tips on handling your dog to help them feel better. So how do handling techniques affect pain? So as I've already mentioned, if we can reduce stress, that's actually going to leave dogs feeling more comfortable. They'll be less anxious, they'll be less prone to their muscles seizing up with anxiety, and that reducing their stress levels will also reduce the chances of their nervous system sort of misbehaving and reduce the chance of them getting into that situation called wind up, in which their nervous system behaves inappropriately. So handling techniques, good ones, can reduce stress. And let's look at the basics of gentle handling. If you were to ask me my top 3 tips on gentle handling techniques, it may be these. So the first one is slow down. It just gives the dog a chance to sort of accept what's happening and to really to sort of understand and process what is happening, what you're doing with them. To slow down your movements and take the time to watch them and check how they're responding. Talk to your dog in a kind voice. They probably won't understand all the words you're using, but they will understand the kindness in your voice rather than sort of snapping at them. And I know it's easy, it can be easier said than done because sometimes we can easily get stressed ourselves and feel like we're in a hurry and we sort of desperately need to do something. But just see if you can deliberately put a note of kindness and keep your voice at a sort of level tone rather than having it kind of go very high pitched as well. So that can just help your dog to keep calm. And remember to have kind hands. And I know, all of you as dog owners, I'm sure you're naturally kind people with your dogs, but sometimes when we're in a hurry, it's easy to grab onto the dog or to dig our fingertips in actually by mistake. So just keep reminding yourself to have kind hands. Think of your hands containing the dog, perhaps like in this picture, rather than grabbing onto them. So the lady in this picture, this is a French bulldog that she's steadying here, and this is a particularly nice way to sort of restrain or steady a French bulldog. 2 hands round the shoulders like this. It just keeps them contained and it allows them to find their own balance there, but it stops them rushing forward. So she's got nice soft hands there. And if he were to suddenly see a bird or a cat and it all goes wrong, she can always grab onto his harness. He's got a harness there. So there's no need to really dig your fingertips in this situation. think about how you're positioning yourself when you're doing things with your dog, perhaps when you're checking their surgical wound or sponge bathing them, for example. So generally, it's best to face in the same direction as your dog when you're trying to do something with them. They tend to find that less overwhelming. It's all to do with dog body language. Unlike people, dogs generally find it a little bit overwhelming if people are looking directly towards their face. And as you're doing anything with your dog, just bear in mind what they might be thinking. So supposing you were helping a human who had a back problem, for example, now you'd really want to know what that person was thinking. And the person would probably tell you. They might say something like, oh, I'm a bit worried about this, or I'm not sure I can do that. Or they might just look anxious in their face, or they might actually sort of really snap at you or swear at you or something. But you'd probably quite easily get a picture of how they were feeling. Now with dogs, sometimes we have to really look at them carefully to understand what they are thinking. So here we've got Darcy modelling for us. And in this picture on the left, she's very relaxed and content. Of course, her head is resting. But not only that, also the muscles of her face are really soft. So she's got this sort of very soft expression in her eyes, and her ears are just relaxed here. And then this is actually just a few moments later. So we just touched perhaps a sore spot, or she just wasn't quite happy. And now this is a picture of anxiety here. So yes, she's raised her head, but also she's got very tense around her face. We can see the white of her eyes here as she's suddenly turning, and just, it doesn't always mean anxiety, but if a dog suddenly turns and you're suddenly seeing the whites of their eyes where you weren't before, that often means they're just really quite on edge. They're a bit anxious and worried. Muscles around her eyes are tense, and actually there's something subtle around her muzzle as well, with those muscles being tense too, and her ears are pulled down. So with her in this position, this person here actually, really needs to, I would say, take their hand off there, just give this dog a little bit more time and space to relax. And here are some other typical body language signs in dogs that it's worth understanding. So these are two more signs of anxiety. In the picture on the left, let's go back. In the picture on the left, so this dog is just resting on her owner's lap, and he's just stroked along, and he's just touched a point she's not quite happy with. And what she does is she yawns. Now, she might not be in terrible pain, but she's just a little bit anxious, or perhaps just a touch sore there. So she's trying to tell her owner, trying to tell the people around her by yawning. That's a body language to mean, I'm not quite happy with this. And in the picture on the right, now this was actually a dog from it was a rescue dog in an animal shelter being handled by one of the carers or workers there. Actually being handled very, very closely. So the person is actually facing right into the dog and two hands on that face. And it's just a little bit too overwhelming for this dog. And what this dog is doing is she just got a little lip lick. So she's just very quickly flicking her tongue out. And that is just saying, I'm not quite happy with this. And if she were a person, she would probably say, oh, I'm not sure, something like that. But yeah, so this lip lick just means I'm not quite confident here. Please give me a bit more space. So sometimes these signs get a bit lost in translation between dogs and people. The dogs are actually trying to communicate to us when they do the yawn or the lip lick, but it's so different to human body language that these are sometimes missed. So watch out for those when you're doing something with your dog, like for example, if someone's prescribed that you should massage your dog, just watch them, watch your dog as you do that procedure. And if your dog is yawning or lip licking, just be aware that means they're not quite happy. So if they are anxious, if you're seeing these signs of yawning, lip licking, sort of flinching away or turning their head or getting very tense in their face. So pause what you're doing and think, do you need to adjust your position? So perhaps you're sort of leaning over the dog, you need to back off a little bit. Perhaps you need to turn so you're actually facing the same direction as your dog, and that would be better. And think, did you touch a no-go spot? Perhaps it's just an area your dog can't bear anyone handling, like many dogs just won't let people touch their paws, they're just too anxious about it. Or perhaps they've had back surgery, or they've had a pain with their back, and it's just too close to that area. So if so, move your hand away. And if you need to continue with what you're doing, I suggest that you just take a deep breath and then just reset yourself and then start again a bit more slowly, even more gently. Or in some cases, it's best just to stop what you're doing for a while. And if you were doing something like perhaps something prescribed, like a range of movement procedure or something, and if it is just, if it's causing anxiety and this anxiety doesn't settle down with you trying to do these things more slowly or gently, if that's the case, I recommend that you actually go back to the vet or the physiotherapist who prescribed this and just mention it to them and find out whether they'd like you maybe to try something else instead, or maybe even just stop doing what was prescribed, because we certainly don't want to be causing anxiety in the procedures we're doing. So in general, it's a really good idea to fit your dog with a harness during recovery. Its top acts as a useful grab handle. That's much, much better than grabbing onto your dog. And if we just look at how these harnesses fit on. So the best harness to choose is one with a Y-shaped front. And that means that the harness, if you steady your dog from there, you'll steady them from the top of the harness round the back, but the harness is actually going to put a little bit of pressure on the breastbone of the dog, the sternum here, sometimes called a keel in dachshunds. And that's a great place actually to sort of steady your dog from. They tend not to have a sort of a panic response or a sudden pain response triggered by pressure being applied here. And it also avoids putting pressure on their neck, as you might get with a collar. And these slanting bars of the sort of Y-shaped front, they're not going directly over any joints or other delicate structures. So that's quite a nice sort of design. And another way in which you can just steady them from their breastbone area is just to put a nice, kind, soft hand round the front here, in front of their chest. And that can just help to steady the dog. It stops them kind of lurching or hurrying forward. That could be, for example, if you're sponge bathing and you might steady them with one hand here while the other hand is cleaning them, or perhaps it might be on the vet table if your dog's being examined. So I'll also show you a technique called lead stroking. This is freeze framed here, but I'll play it as a video in a moment. And this is a fantastic technique for dogs that are a bit sore, or even if they're very painful. It's useful to do for any dog that can actually walk. So you won't be able to do it if your dog is using sling support, because then you won't have, you need to have two hands on the lead for this technique. So let's play the video. So this gentleman is just stroking along the lead, and this was a dog quite shortly after spinal surgery, so she was still very weak. She's actually lying on her front here and just, I think, eating the grass, and then she's able to walk forward. And this technique, I often use it when the dog is standing still, but it could also be when they're lying or sitting. It tends to be when they're outside, perhaps during their toilet break. And it's something I would even do as a vet. I often do this when I'm visiting on a home visit, and we have to get the dog outside just to assess them, and they need to get to the toilet as well, but they may be very painful in that situation. And this is something I know is very, very unlikely to spark off any pain. And often they find it quite soothing, and it can just help them actually sort of balance over all four limbs in quite an organized way. So I know she's not actually standing there, she was lying, but believe me, for this dog, that was a very organized kind of lying down, and a very nice way she got up at the end of it. So in a moment, I'll show you another video of the same technique, which might just show perhaps a little bit better what the hands are doing. So this is a much stronger dog who's standing up, and I'll play the video in a moment, but just before I do, I'll just point out that you've got two hands here focused on the lead, and we're going to be stroking a little bit like the action of hauling in a rope. Although I must say, for a weak dog, it'll be much more gentle than hauling in a rope. Think about maybe stroking your hands along a thread of silk or something instead. But like hauling in a rope, the palms of your hands go under the lead. Let's play it. And the lady's keeping the handle end of the lead in one hand. She's not letting go of that, but she is using both hands to stroke. And this lady can also actually even lean back as she's doing this. She can really stand up and relax and lean back. And that's very nice, because the dog will actually sense if you are getting tense, they're going to sense it, and it's not going to help them. So if you can find a way of actually relaxing, that helps them. And this sort of rhythmic stroking along the lead can be very soothing. This is actually quite a strong dog here, and you can really sort of see his muscles switching on. But in a weaker dog, you would do the same action, but more gently. I'd also like to show you in a minute, this is another video that I'll play for you. So this is going to be something called Tellington T-Touch. And I'm partly sharing it here with you, just really to show you how, even without doing the Tellington T-Touch itself, just sitting quietly with the dog can be positive. But also, this is a very gentle touch technique, and this is just illustrating how gentle we sometimes need to be with these dogs. So what's happening here? This is actually a dog that I was doing a first assessment on, and in fact, this was a long time after his surgery, many months after his surgery. So he wasn't primarily there for a pain issue, but I would be as gentle as this. No, even for a dog that's not particularly painful. And in fact, for a dog that's really painful, I would probably avoid touching as far back as this. So just be aware, if you're asked to do anything like massage, for example, it really does need to be very, very gentle. And sometimes techniques like massage are actually best avoided in dogs that are experiencing pain. Now, a couple of just positive points from this video. So one is we're on a non-slip surface. It just helps the dog to just stay balanced and not slip over. Another is that throughout what I'm doing here, I'm just propping the dog with one hand. So this was a dog that had never learned to walk himself independently, and he didn't even find it easy to stay upright. He was so weak on one side. So I just play that again, and you just see how I'm just steadying him there with my left hand while I'm doing something with my right hand. And so I'm just sort of steadying him so that he feels balanced. So it's just a gentle approach, facing the same way as your dog. making sure you don't knock them off balance by mistake. It's so easy to do. And just watching them, watching their body language and responding with care. The Tellington T-Touch, that's sometimes something done by dog owners. And if any of you are really keen, you could go and look it up. And there are courses that you can actually book yourself into. It's a whole very interesting procedure, and it's something you can do with healthy dogs. And if it's something, you know, if you learn that technique, you could then have that in your repertoire of things you could do if they're having a bad day. So let's finally look at how we can also adjust our dog's activity to help them feel better. Put this in for a laugh, but watch out, your dog may get pain flare-ups if they do too much. Well, we do actually talk sometimes about the pain overactivity cycle. So maybe this is what that cycle is. So pain overactivity cycle is where, you know, dogs are feeling painful. Then when they start to feel better, they just do too much, and then they end up feeling painful again, and we're back to square one. Well, hopefully they won't be riding bikes and doing circus acts. But more likely in a typical home, we'll see these kind of causes of pain flare-ups. So what often happens is, you know, the dog hears the doorbell ringing, or they hear there's post that comes through the door, and they might just try and rush across the room. Or then you may find that they're not actually running, they're just lurching a little bit faster than they should. And that can really cause a pain flare-up, especially if they're going over a slick floor, like a wood floor, or really any hard flooring in general is too slick for these dogs. And even if they don't fall over, they can have pain flare-ups. Sometimes their paw just slips by about 2 millimeters. The paw goes one way, their body goes the other way, and they just end up much more inflamed than they were. So that's a risk. Another thing that often happens is that dogs may jump out of habit. They may be really used to going on the sofa, and they might surprise you. They might look like they don't want to do anything, but suddenly they surprise you and try and jump up on the sofa, which they really shouldn't be doing. And another thing we often find happens is that people put dogs on the sofa, and then they hear the doorbell or someone comes in and the dog just tries to leap off. That can really cause disaster for them. And they may just also, you know, hurry over steps or stairs is the other thing. And outdoors, you've got to remember dogs often just act on instinct. So they might just, you know, they might look like they're not about to do anything, and then they might suddenly rush, and perhaps rush over steps or stairs, even rushing over the doorstep in a dog with short legs, like a French bulldog or certainly a dachshund, is enough to cause pain flare-ups. And even in this sort of nice, tidy little garden, there might be wildlife like this pigeon here, or a cat that might surprise you and have, you know, the dog might just lurch after it, or they might see a ball and suddenly decide to rush off somewhere. So remember that dogs act on instinct. They often just forget themselves and do something that they shouldn't, and then the pain flares up. So we really need to be their guardians and remind them not to do too much. From a practical point of view, that means setting your dog up in a safe recovery area. This is a pen appropriate for a dog during early recovery. Of course, if your dog is likely to escape, like if they don't respect barriers, such as stair gates and things like that, then they'd need a closed top crate. After around the first 3 weeks of recovery, or once your vet is happy for you to do so, you can actually extend the floor area of their recovery space a bit. Now, this was a little dog who had been suffering from very severe neck pain, and he was also a very anxious character. It was a family home, and he would react to everything. He'd even react to the wind, the sound of the wind coming through the walls. And his owners were quite worried about actually confining him, or what should they do. And he really settled very, very well in here. And one thing we did, this was summer, so the radiators were off. We covered some of the surfaces, especially this metal surface, with fabric, just to deaden any sounds echoing around. And we covered this so he had a sort of hidden area to rest in. It's got a non-slip standing area, and the bedding is not too thick, so it's easy for him to get about within this space. So he did very well in there. And that the bedding is important just for the dog's comfort, to have suitable bedding. Most of these dogs do need some padding. It doesn't necessarily have to be very thick, so it could be, this is just a crate mat here as this padded layer. And this dog, this is Darcy, and she's got a top layer as well of fleece. It's a good idea to have a top layer, especially if your dog doesn't have 100% perfect bladder and bowel control, which is quite possible during IVDD. And then you can make sure you can keep everything clean. The other thing you might need in the way of bedding is something to block any drafts, because if your dog is lying in a draft, that's going to really make their muscles seize up more than before. So rolled blankets can be helpful to just block drafts. And as you get your dog out of the pen or crate, do carry them out, carry them over any steps or stairs or slick flooring. Certainly don't just open the door and let them come out of their crate or pen. There are a lot of pain flare-ups that happen that way. Often the dog's just really rested, open the door, and they kind of rush out, especially over a slick floor. It's really asking for problems. So really get them out in a careful way, and then over the step, do carry them to the garden. I've put in two different pictures here just to illustrate the fact that there are many different ways of carrying a dachshund. You really need to do what feels comfortable for you, but the main thing is don't let one end of your dog dangle unsupported. You want to keep their back fairly level, fairly horizontal, and it's a good idea to get your dog in close to your chest, because then they'll feel more stable. It's also going to reduce it'll also make it more comfortable for your back actually when you're lifting, if you can keep them close into your chest. Outdoors, do keep them on a lead. As we've already mentioned, there are all those risks out there and we don't want them to lurch off unexpectedly. Got a video here just illustrating how you really want to walk slowly with your dog and stop with them if they stop. So you want your dog to be walking, not trotting. This is during the early stages of recovery. I'll just play that again. This is walking. So it might look quite kind of ungainly and strange to see a dachshund walking like that, but that's the correct speed to go at for them. So it really means walking very slowly, and use a fixed length lead, not an extendable one. Even if you have an extendable one and put it at a fixed length, that's actually not great, because the handle is so unwieldy. It's very difficult to have fine control of what your dog's doing. So of course, you know, on day one, use whatever you have to hand just to keep your dog restrained, but then get hold of a fixed length lead to walk them sensibly. You can also possibly make some adjustments to your home. Here's a lovely ramp for this dog to go up, and he's going up there on a lead with his, as he's learning to use it, he's going up on a lead with his owner going very, very slowly behind him. That's the best way to do it. It's a very nice shallow ramp, and it's covered with artificial turf. It's play that once more, which is quite a nice surface for dogs to balance on. Okay. If your dog's still painful, definitely do see the vet again. So bear in mind, they might be having bouts of pain, so the pain might sort of come and go. So don't be too alarmed by that. But if you're finding, say, the number of bouts of pain, it's no better at all after 5 to 7 days, I recommend go back and see your vet. Sometimes they just need to adjust the doses of the medication, maybe add something else in or swap something else in. But they should re-examine your dog, and occasionally it's necessary to actually organise a neurological referral just for the pain issue. If your dog's actually getting worse, be prepared to bring them in even sooner than that. But having said all that, bear in mind, it's a healing process and it does take time. And also bear in mind, the painkillers, they will combat some of the pain, but not 100% of it. So for example, we know those non-steroidals, those things similar to, for example, Metacam and drugs similar to that, we know in people, we expect them to take away about 20% of the pain that the person's experiencing. So they're not going to completely remove the pain. We also need these other things in place, the doing less, the resting, and the comfort and reduce stress, and to some extent allowing time to take its effect as well. And these dogs do generally get better and better. And while you're waiting for your vet appointment, do check your dog's home routine, because that really is so important. Sometimes we find, in fact, very often we find that just little changes to what's happening at home can really, really change how comfortable the dog is feeling. So they should be in a suitable crate or pen, not too small, but they should be contained. They need to have some non-slip footing within that crate or pen area. And if you're actually taking them out of the crate or pen and having them maybe walk on a lead through the home, then check that the flooring they're using is non-slip there as well. So you might need to put down some non-slip runners or mats. Dogs that are painful should have a good harness. It really does make a difference to how well they do. A harness with a Y-shaped front. And think about the dog's routine. So if they've got persistent pain, if they're in that painful state, they shouldn't just be wandering loose. You will otherwise find that the pain keeps flaring up as your dog kind of lurches towards this or that, or something happens briefly, and they keep going back to square one. And think about what's happening during their toilet breaks and their outdoor time. They might, in the past, when they were healthy, have just been let out of the door to go off on their own in the garden. That's no longer appropriate. They need to be on the lead during the toilet break time. But it's for a period, and then gradually they will get back to, hopefully get back to normal. So lots of detail there to think through. Lots of aspects of pain relief. So that's all. I imagine many of you may have questions, and I'd be happy to answer these. And you can find me, I've got a website with a lot of information, guidance for dog owners at therehabvet.com. So I'll stop sharing now, come out of this, and I'm happy to take any questions.
Marianne, thank you very much for that. I'm going to stop the recording and we'll take the questions after I finish the recording.
Thank you.